Project and welcome to your weekly tutorials. I think I'm going to be the only one giving the tutorial this week. Today we are going to be covering a few things. I want to dive into the leg series to help you understand that form a little bit more. I also want to touch on the bridge, and then I want to make sure that we cover all pregnancy alternatives that you may need for this routine. So you'll find the pregnancy alternatives at the end. In the meantime, let's get started with the leg series. Our leg series this week is a little bit different than what we are normally used to when you see kneeling single leg work. So usually we're propped up on all fours, and I would say that oftentimes the motion is a little slower and more controlled. And this week, we're moving a little more aggressive and a little more explosive. We are also really working to do a turnout with the hip when we kick our leg to the side. Now, because we are taking that turnout and because we are moving a little more explosive, I have offered you an elbow on the ground on the same side as the standing leg. Now, this may seem a little bit counterintuitive because, as you all know, when we do kneeling work on all fours, you don't want to let yourself really sink into the hip, right? So you may think initially that bringing this elbow down is going to cause you to sink more. But actually, this elbow here is designed to give you a little bit more of a base on the floor or on your block or on the chair, wherever it may be. It's designed to give you more of a base to help you steady yourself so that when you take the kick, you can really lean toward your kicking leg, okay? So what I want to do today is I want to talk a little bit more about the form of the hips when you kick to the side, as well as shifting your weight toward that lifted leg. It's a mouthful. Let's go, y'all. Before we go any further, I want to say this. You know your body better than I know your body. So if you want to take this series up on both hands, you do it on both hands and you're like, this feels best for me, I love the way that it feels, go for it. That is not a problem. But today I'm going to show you why having that elbow on the ground may help you with this explosive kick and the turnout with the hips. Does that sound good? You get to decide before I get to decide. Okay, starting with the form. So when we take our kick to the side, we are actually working to lift our hip up and then push out. So it is like you are attempting to stack the hips. Now, here's the way that I personally like to think about it. If I'm lifting this hip up for turnout, this leg that's on the ground, I want to think like I am trying to stretch my inner thigh. And I'm going to show you a visual here. I'm going to get my upper body really high so that way it's not in the way. Here I am with my hips stacked. Here I'm going to peel open to the turnout. Now, in this case, I'm sinking down and into the hip. Do you see that? Now I'm going to take it the opposite direction. I'm going to push, 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 push. Right now, I can actually feel a stretch through the groin and through the inner thigh area. That stretch is probably, personally, I think it's the way that you can make this exercise feel the best. So when you take that kick out to the side, you're kicking out, you're trying to lift the hip, and you're trying to push open so that you feel that little stretch going on in the inner thigh. As you do the series this week, I would like for you to focus the most on achieving that turnout and feeling kind of that inner thigh stretch, then on stacking up the hip and keeping it perfectly still. So when we do this series, your leg is quick. It's a quick kick. You're not holding it up there for a long time. There's a chance that you're gonna lean a little bit just because of the position. That's okay. But if you can focus on turning the hip open, you have more chances of hitting the correct form. And I want to show you what I mean. So if I'm just here and I'm just extending the leg to the side, by the way, this is really, really tough. I'm not super turned open in this position, it's going to feel a little bit caught, a little bit stuck. Instead, if I focus on really turning out here, turning the hip open, you can even look to the side. That is where I'm going to get that hip mobility, a nice open stretch. I'm gonna get more range through the leg, and I'm not gonna feel like I'm sinking down here into the hip. I'm gonna feel like I'm turning everything open to get a nice extension and then coming back once again. In the bridge this week, we are doing an arm series, and I've kind of thrown in this new position, which is where we're bringing the elbows and the palms together and we're taking a pulse up. Now, I want to address this position because if you have a super tight upper back, moving up through the top, kind of like thoracic or cervical spine, if you're really tight there, there is a chance that this one just hurts, okay? And it just doesn't feel right and your body is not responding to it. So I want to give you two different options. Option number one is to go ahead and press the palms together while working the elbows a little bit closer so that way you still get a stretch through the upper back. However, if you're like, nope, that still doesn't feel good, I want you to take this moment in the bridge to move into a stretch instead. So you're going to interlace your fingers like so. Then you're going to flip the palms, push out. You may find a stretch just doing this, but if you need more, you can tuck the chin. And then to go deeper, it is reaching forward, rounding the upper spine so that you feel this nice big stretch going across from shoulder blade to shoulder blade. Does that make some sense? So one more time, if this position feels ouch, painful, no good, skip it, interlace the hands, move into a rounded upper body stretch. Next up, we are going to talk about pregnancy alternatives. I'm going to start by talking about alternatives for the warm-up. So you'll notice I have a nice pillow fort here. If you are pregnant specifically to the point where you have popped enough, like maybe this is third trimester pregnancy, you do not feel comfortable laying on that ground, the warm-up does not work for you. And there is a portion of pregnancy a little bit earlier on where it can totally work for you. So I'm gonna leave this up to you. But if you're further along, laying down in the back, doing some of that work, not feeling good, we're going to resort here to pillows. Now, if you had a wedge mat, right? It looks like a wedge of cheese, like a triangle. That is actually the most ideal thing that you could work with. But if you don't have that, it's totally fine. I have taken 3 pillows. I put 2 down here. These are actually memory foam, so they give me a little slant up. And then I've taken another pillow on top to support my back. When we lay down on this, we want to be at a nice angle with our upper body so we are not flat. And you can use as many pillows as you want to get yourself propped up there, okay? Now, once you're here, again, this kind of depends how far along you are. You may actually feel okay taking the warm-up kind of as it is, circling that leg through, coming up for the hamstring stretch. Like this may feel good for you, and you can basically follow along with the warm-up as is, okay? However, if you're in that third trimester, if twisting over to the side is not feeling right, I want to give you a nice alternative. It goes a little something like this. You're actually going to start with both of your knees bent, and you can have your hands beside you on the floor as a support. On count 1, 2, 3, 4, you're going to prop your right ankle up to your knee. If you feel a nice stretch here, you can hang out as is, or if you want it to go deeper, you're going to lift your bottom leg off the floor and kind of grab around your legs for a stretch. So this would be hold 1, hold 2, hold 3, hold 4. For 5, 6, 7, 8, you can stay here, or you can let your legs fall to the side. So I support my bottom foot on the floor. I don't have to tip all the way down. I just get this nice little stretch. You're gonna feel it on the outside of the hip. you would hold 5, hold 6, hold 7, hold 8. Now we're going to let the leg release. We're going to extend it out, and then we're gonna come up for any sort of a hamstring stretch. And you should definitely kind of circle your ankle around. I am holding a soft knee right now. I'm pulling in on my calf a little bit. You can even pull in on your thigh, and you would spend the entire 8 count right here, okay? Then we switch on count 8. So this is how the whole series goes. I'm going 1, ankle crosses 2, option to lift my bottom foot off the floor, 3 and 4. Then I fall to the side, it's 5 and 6 and 7 and 8. Now I let my leg extend, bring it out. I'm reaching up, this is 1, rolling ankle 2 and 3 and 4, getting that little tug, 5 and 6, it's 7, switching feet on 8. We stretch for 1 and 2 and 3 and 4, maybe fall to the side, 5 and 6 and 7 and 8. Let the leg extend, 1, hamstring stretch 2, rolling ankle 3 and 4, then continuing that stretch on 5, 6, 7 before switching on 8. For the oblique series, the pregnancy alternative is going to involve a chair. However, before we go any further, I want to make sure that if you are pregnant, you have watched the pre and postnatal tutorial. I do cover things such as this, and I also provide go-to exercises that you can do in case there's a move that you don't really know what to do with. So just make sure that you have watched that. We do cover seated abdominal work in that tutorial, but let me show you what it looks like here. So you want to have a chair that you can work with. You're going to extend your legs out to a bit of a tippy toe, and then you're going to take a scoop back. Now, this scoop is not like a dramatic crunch, okay? What you're doing is you're working through your pelvis, through the lumbar spine, which can be really, really great during pregnancy. It can help strengthen the pelvic floor and just feel kind of good for the body. So, grabbing behind the legs for extra support, go ahead and take a little bit of a scoop. Pubic bone tilts up toward the ceiling. Hands are here to support the body. If you don't feel like you need the support, you can release the hands, but I want you to be gentle with that. Now, instead of taking a twist, right, you're gonna completely delete the twist, and instead, you're gonna work on this pelvis rotation. So it's going to be scooping down, down, and then rolling yourself up and up. So we're thinking long spine, then we're thinking about scooping through the spine. Rising up to the long spine and then scooping. And every single time you scoop in, I want you to imagine kind of an internal lift or an internal squeeze. That is the pelvic floor engaging. So as you come down, scooping, 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 get yourself that little squeeze like you're holding in your pee, and then lengthen the spine right back up. Another option is to add a little extra jazz with an inflatable ball. This is a 9-inch inflatable ball. I didn't inflate it all the way, it's still kind of squishy. 6-inch works as well. Kids' play toy also works. So does a Pilates ring. Basically, anything that you can squeeze between your knees can be really helpful. So you would take the ball, you place it in between the knees, and I'm gonna give you 2 options. One is to keep a long spine, no scooping at all, and just practice squeezing the ball and releasing. You could even add a tricep dip with the ball squeeze if that feels good for you, okay? The next option is to continuously squeeze as you take your scoop and as you lengthen the spine back up. Here's what I'm gonna say. You can take the scoop as long as when you scoop down, you don't see that coning in the belly. If you see the coning, it is always a sign that you need to pull out of it. And if you're not quite sure what I'm talking about, again, watch the pre-postnatal tutorial because I really describe what exactly is happening when you see kind of that coning going on in your belly. Does that sound good? All right, y'all, good luck this week.